Hi, I'm Dr. Daniel Meyerkort from Perth Orthopaedic and Sports Medicine Centre, and today we're going to talk about the lifespan or longevity after knee replacement surgery. So patients commonly come into clinic and they say, "Doc, I heard these last 10 or 15 years." The good news is that the vast majority of knee replacements are going to last far longer than 10 to 15 years. Certainly, we're not in an era where everyone has knee replacement and then all of those patients come back in 10 to 15 years for a redo. In general, if you look at all comers in Australia, the rate of failure is about 0.5% per year. This means that if your knee replacement has been with you for 20 years, there's a 90% chance that it is still functioning fine and a 10% chance that you've had redo surgery. If you're a younger patient, so if you're less than 55, your rate of failure or needing redo is higher, and it would be around 1% per year, which is double the rate that I previously quoted. This would mean there's around an 80% chance of your knee being fine after 20 years and a 20% chance that you would have had a redo. If you're older than 75, the rate of failure of knee replacement is significantly lower than either of those rates that I've quoted, and certainly it would be unusual to wear out or require redo surgery. From a practical point of view, patients that I see that are 60, 65 or 70, the most likely outcome is that they'll have one knee replacement and that knee replacement will outlast them. Practically, I think patients that are having it done in their late 40s, early to mid 50s are likely going to need a revision or redo surgery at some point in their lifetime. For this reason, if you're in that younger category, you should really think long and hard. Is your knee pain bad enough to warrant going through surgery at this time point? Because although you may be happy for a long period of time, you should expect that you may need redo surgery in the future. In my practice, there are things that I utilize to try and minimize the rate of failure or revision surgery in the future. The main prosthesis that I use is the Persona knee replacement from Zimmer, and it has an extremely low rate of failure. It's based on their prosthesis, which was called the Next Gen prosthesis, and the Next Gen has got an excellent track record and had the lowest rate of failure at 20 years follow-up of any prosthesis available in Australia. I routinely resurface the vast majority of kneecaps because, again, this is associated with a lower rate of failure compared to not resurfacing the kneecap. I also routinely use a small stem on the tibia to give the tibial component some extra support and fixation to your bone, as again, there is some data to show that this will decrease the rate of failure from tibial loosening. So in summary, most patients' knee replacements will last a long period of time.